A man crashes his truck into a house and was taken by life flight helicopter to Legacy Emanuel for care. After he gets into the emergency room, it is noticed that there's an unusual odor about the patient, probably weed killer the patient drank before crashing his truck in a suicide attempt. The smell was tolerable in the emergency room because of the large rooms, high ceilings, and better ventilation. When he was moved to the considerably smaller rooms in the ICU, the odor became intolerable by the staff. Many nurses were in the room less than a minute and were complaining of problems with headaches, coughing, nausea, and dizziness and had to leave the room. The safety officer for the hospital was contacted, and he called back about 90 minutes later. The only solution they could come up with eventually after several hours was to get some painter's masks from Legacy Good Samaritan Hospital. The masks were not adequate, but helped a little bit. This process took at least 2.5 hours. The smell was what you would get if you poured weed killer into a bucket and stuck your head in it. We had some more effective ideas to deal with this problem, but the surgeon on at the time was not willing to take those measures. Afterwards, I attempted to address this issue with the manager of the ICU many times over the next several months. I asked that the problem of not having a plan to protect the staff in any future exposures of this type or others needed to be discussed. I was ignored and informed the manager I felt it necessary to go outside the hospital if they would not even discuss the issue. I had no other choice but to call OSHA, the Occupational Safety and Health Administration, and got some help from them. They came into the hospital unannounced and made sure the adequate contamination equipment and policies were in place. Their comment to me was that the hospital could have called them and discussed the issues with them for a satisfactory solution without the complaint.